Spokesperson for the Free State Department of Health, Mondli Mvambi, joins us now to share some insights about this disturbing report. A very good evening to you. Thank you so much for speaking to us. As you heard from UNICEF mentioned earlier on the issue of rape, and I'm just wondering how many of these pregnancies from your statistics show that statutory rape was the result of the number of teenage pregnancies and even terminations that we saw during this period.
Good evening, Tepiso, and good evening to all your viewers at home. It's quite a disturbing phenomenon that has come to grips the work that we do. We see a lot of young children getting pregnant, and unfortunately, some of these cases do not progress as expected to the stage where there are cases that are being opened for statutory rape, because the suspicion is that these are issues that are happening in amongst within the community, amongst people that know each other, and it's socio-economic factors that might be at play, which play themselves into conciliation of these acts that are unkind to children. They rob the children of their childhood, but as socio-economic factors, they are seen as things that may be contributing to the sustainable livelihoods of the families in the wrong way, of course. So it's very difficult. We have not been able to proceed to that side of the work where we see the successful conviction of those that are perpetrators of these horrendous acts.
And I mentioned statutory rape because later on we'll talk about the fact, and we saw from the report from our reporter the fact that the power dynamics, because of the socio-economic challenges in our communities, that they're often ignored. People pretend that this is consensual sex, whereas it is sexual assault, statutory rape. But now I want to look at the national figures. So adolescents aged between 10 and 19 represent a proportion of the population of 17.4%. And I'm wondering, what is the ratio in the Free State? We're looking at a 5-month period, but if we're to look at the past year, what is the figure? I suspect that it may be quite a lot, a very significant number.
Well, it has gone down in the past 5 months in comparison to the previous periods. You would remember that we come from a period of COVID-19 where some of these statistics were seen to be going the wrong way. But soon after COVID-19, especially the period, the past 5 months period that we're talking about, the numbers have gone significantly lower. Well, it could be attributed to a number of factors. Maybe the interventions that are being done by intensifying the work on youth-friendly zones, because you would understand that the strengthening of youth-friendly zones in our clinics enables these children to receive attention at a very early age. Prevention programs are also strengthened. Children are becoming more aware. Children are becoming much more occupied in school as opposed to non-school activities. So those interventions, they actually contribute to numbers going down. We are hoping that with further interventions, this will be going further down, because the MEC of Health in the province, together with the Deputy Minister of Health, Dr. Spokesperson Lomo, embarked on campaigns, for instance, in the regions of Kwakwa, of Thabo Mfutsanyana, and in Mangaung during the month of August.
Okay, before we run out of time, I want to look at family.
Teams.
I wanted to look at family planning. You mentioned that, but just looking at statistics, it seems that non-white adolescent part of the population don't really have access to medical services. And I'm not just talking about sexual and reproductive health rights. So another issue is the prevalence of early and unprotected sex with multiple partners. So the education drive around this, including the incidence of HIV infection and other sexually transmitted infections amongst the youth. How much funding are you pouring into this? How are you modernizing it so it's not just talking down to young children, but actually helping them to understand the real dangers?
Well, it's part of in collaboration with the Department of Education, for instance, there's been intensive drives to upscale the level of education, both at your higher education, your basic education and higher education levels. So that's contributing significantly because it's not only children being talked down to. With the intervention of our partners, development partners, children are a significant part of the learning process, the understanding process. That makes them to be, much more active participants in this. So it's contributing a great deal in the reduction of numbers and enabling that sexual and reproductive health services are much more open to them. So they gaining greater understanding, okay. But also in terms of the youth-friendly zones that I talked about, you are getting much more people that are making these services to be much more available, to be much more acceptable to the youth that are supposed to be consuming them.
Appreciate your time, spokesperson for the Free State Health Department, Mondli Mvambi, about the shocking statistics coming out of the province. Girls between the ages of 10 and 14, a total of 150 of them having given birth in the Free State in the past 5 months, not to mention the number of teenage pregnancies, more than 14,000, and the number of teenage pregnancy terminations, more than 2,000 have been reported in the past 5 months.